All right, I will call this meeting of the Joint Subcommittee on General Government for the Assembly Ways and Means and Senate Finance Committee to order. Will the Secretary please take the roll?
Assemblymember Backus. Present. Assemblymember Koenig. Here. Assemblymember O'Neill. Here. Assemblymember Torres Fawcett. Here. Assemblymember Watts. Senator Buck. Here. Senator Taylor. Present. Assemblymember Anderson. Present. Chair Scheibel.
Here. And please mark Assemblymember Watts absent, excused, or present if he gets here before the meeting's over. All right, we just have one budget hearing on our agenda this morning, so we will go ahead and welcome our friends from the Silver State Health Insurance Exchange up. And I will open the hearing on budget account 101-1400.
Thank you, Madam Chair, members of the committee. I'm Russell Cook, for the record, Executive Director of the Silver State Health Insurance Exchange. And we appreciate the opportunity to talk about our budget for the upcoming biennium. So, first we're going to take a look at a little background contextual information about our agency, including our vision, mission, values, strategic priorities. We're going to talk a little bit about our performance in recent years, in particular, our record-setting enrollment numbers for 2025. We're going to talk a little bit about the flexibility that our operation as a state-based Affordable Care Act marketplace affords us. And then we're going to dive into the meat of the presentation. We're going to talk about the enhancement requests, a couple of new positions, some travel and training memberships and registrations, as well as the more mundane equipment and OCIO expenses. And then we're going to conclude by talking about our reserve levels and finally reserve a little bit of time at the end for questions and answers, of course. All right. Thank you, Jonathan. With me today is Jonathan Lopez, our finance officer. He was instrumental in preparing this budget. The Silver State Health Insurance Exchange, or SSHIX as we're known, we are a state-based Affordable Care Act exchange, and we operate the online health and dental insurance marketplace, NevadaHealthLink.com. We connect Nevadans who are not insured by their employers, who are not eligible for Medicaid because of household income, or who are not eligible for Medicare because of their age, to quality health and dental insurance. Individuals can purchase Affordable Care Act certified, qualified health and dental plans through the exchange and through the NevadaHealthLink.com website portal. And if eligible, consumers can receive subsidy assistance to help offset monthly premium costs. And almost 9 out of 10, I think we're at about 87% of our enrollees do receive some sort of monthly assistance to reduce the cost of their premiums. So I'll talk a little bit about our vision and mission statement. The vision is simply to increase access to health insurance for all Nevadans. We are laser focused on reducing Nevada's statewide uninsured rate. Our mission is to increase the number of insured Nevadans by facilitating the purchase and sale of health insurance that provides quality health care through the creation of a transparent, simplified marketplace of qualified health plans. We are the only place in Nevada where 8 different insurance carriers offer health plans, and it's very easy for our consumers to compare and contrast those different health plans in a one-of-a-kind competitive insurance marketplace. Our agency values consist of being consumer-focused. At the center of our efforts are the people we serve, including patients and their families, small business owners and their employees, as well as the many insurance carriers and sister state agencies that we work closely with. We aim to be innovative. We strive to be an innovative and forward-thinking organization. We aim to promote diversity in our stakeholder communities, in particular our broker and agent and navigator communities. Those comprise our enrollment professionals throughout the state. We aim to promote diversity through an extensive network of community partnerships throughout the state, both in the urban areas and the rural areas throughout the state. And then we intend to maintain a business-friendly environment. We are committed to creating a business-friendly space for the simple purchase of health insurance and the relationships that we maintain with the health and dental carriers that I mentioned a moment ago are instrumental to that goal. So you probably heard me mention a couple of times now that one of our key priorities is to decrease the number of uninsured persons in Nevada, and that remains our number one focus. We aim also to facilitate the purchase and sale of qualified health and dental plans, but above and beyond that, we do intend to provide consumer education and outreach relating to enrollment assistance and effective use of health insurance. I mentioned a moment ago our community partnerships throughout the state. We just went up to Elko a few months ago to help Nevada Respite Care open a new facility up there. They provide assistance to families who have children that have severe developmental disabilities. And so partnerships like that not only allow us to sponsor events to promote awareness of these community partners, but also raise awareness about Nevada Health. We'd like to try and get a 2-for-1 anytime we can. And lastly, I want to mention that we aim to assist residents of Nevada with access to programs, including advanced premium tax credits. Those are the monthly premium savings that I mentioned a moment ago, as well as cost sharing reductions. Those are a different type of subsidy which lower the cost of doctor visits. So I mentioned that we'd talk about year-over-year enrollment, and we're starting to get into the good news here. We have seen a more or less steady year-over-year increase in enrollment numbers. Did want to give you a little bit of background context, though. Back in 2014, when we had our lowest number of enrollments, 38,000, Nevada was using a custom state-based platform that was built by Xerox, and that platform had some technical issues with it that convinced the state to move over to the healthcare.gov platform, the federal exchange platform, starting in 2015. I was hired for the exchange in 2016 with the express goal of project managing a transition back to a state-based marketplace. Took us a few years to get there, but we did officially start that project in 2018, and 2020 was the first year that we offered plans for sale under the existing NevadaHealthLink.com marketplace. So we've been a state-based marketplace since then, and we've also seen more or less year-over-year gains. You can see there was a bit of a high watermark in 2022, just over 101,000 health enrollees, and that was due to the introduction of expanded subsidies under the American Rescue Plan Act. We did see a slight decrease in enrollments in 2023, but it's been steady gains since then, and we did see a 12% increase in health enrollments this year in 2025 versus a year ago in 2024. And I did want to mention also that we had a 4% increase statewide in unsubsidized enrollments. These are individuals whose household incomes are so high that they don't qualify for monthly premium reductions through the exchange. We believe that's a testament to two things. One, our outreach and marketing efforts consistently promote the notion that these plans are the best value at any price. These literally are the best health plans out there at any price, regardless of monthly savings. And we think those efforts are connecting with individuals. We receive a lot of great feedback. We did a number of post-open enrollment surveys in the months of January and February, and the feedback that we received from these consumers back that up. They do consider these health plans to be the best value proposition in the individual health insurance market, regardless of monthly savings. All right, thank you, Jonathan. So we'll talk just a little bit about, drill into those numbers a little bit. Final plan selections, and that includes Health Plus Dental. The numbers on the previous slide were just health enrollments. The final plan selections were 112,951. So that's nearly 113,000 Nevadans that are receiving health and or dental coverage through the Nevada HealthLink marketplace for this year. We did see nearly 27,000 new consumers this year. And I say that you got to take that with a grain of salt. The new consumers goes on the CMS, or the Centers for Medicare and Medicaid Services definition. Any individual who is enrolled in exchange coverage on or after, I should say, November 1st of last year is considered to be a returning consumer. Any individual whose coverage terminated October 31st or prior, it could have been years ago, could have been they were enrolled for a portion of last year, is considered a new consumer. So this number doesn't necessarily reflect brand new consumers that we've never seen before, but it does reflect consumers who had a break in coverage of at least 2 months prior to 2025. Conversely, we have re-enrollees or returning consumers, just over 86,000 of those. And that number is far higher than any previous year's retention rate. And we would cite that retention rate as being one of the primary means by which we were able to achieve such high enrollment numbers this year. So, if there, sorry, saw you moving your mouth there. I thought maybe there's a question. Just to complete the thought, the re-enrollees are individuals who were enrolled in coverage in 2024, and they were passively or automatically renewed into 2025 coverage. That job, the passive renewals job, occurs in October of each year, and this year we set not only had an all-time high finishing number, but percentage-wise, we successfully re-enrolled over 99.9% of our 2024 enrollees. So that is attributable to a number of factors. In particular, we do a lot of data cleanup work in the kind of July, August, September timeframe, reconciling our data with insurance carriers, making sure that any individuals who might have gotten enrolled in Medicaid coverage, might have aged out into Medicare coverage, are taken off of our rolls so that we are not running into eligibility verification issues during that passive renewals job. And then wanted to mention also, just kind of underscore a point that I mentioned on the previous slide. There were 15,499 consumers with $0 monthly premiums. And as I mentioned earlier, it's about a 4% increase over 2024. But that is a significant part of our outreach and messaging efforts, is getting that message across. This is not just about subsidies. It's not just about monthly premium reductions. It really is about landing in the best healthcare available for Nevadans and their families. There's been a lot of talk in Washington recently about special enrollment periods, and just to make sure that I'm providing the appropriate context, once each year, we offer an open enrollment period. For the last few years, that has began on November 1st and continued through January 15th of the following year. That is the only time where Nevadans can freely enroll in health or dental coverage through the marketplace without having experienced what's known as a qualifying life event, essentially a change in circumstances. Could be the birth of a new child, could be the loss of employer-sponsored health care because of a job loss. But outside of the open enrollment period, you need to have experienced one of these qualifying life events in order to enroll in coverage. There are also federally mandated special enrollment periods, such as the ones that we encountered during the pandemic era. So one of those was an exceptional circumstances, SEP, as they're known, which was related to the pandemic, and that occurred back in the second quarter of 2020. We also were required to offer an extended open enrollment period during 2021. I guess that was the December of 2020 through January of 2021. And again, that was in response to the COVID pandemic. There were a few others on here, the most significant of which I wanted to mention had to do with the Medicaid unwinding. That is a reference to the unwinding, as it was known, of the public health emergency, which was enacted in March of 2020. So essentially, a moratorium was placed on Medicaid redeterminations. Anyone who is eligible for Medicaid stayed on Medicaid until the unwinding period began. In Nevada, that began in 2023, in May of 2023, actually. And we spent about a year in the lead up to May of 2023, working closely with our colleagues over at the Division of Welfare and Supportive Services, implementing a number of technology changes that would streamline the process for Nevadans who are transitioning off of Medicaid coverage who wish to enroll in coverage through the exchange. I mention all of this because the flexibility that is afforded to us as a state-based exchange is absolutely integral to these operations here. Were we to have remained on the federal platform, we would not have been able to count on, for instance, that level of integration with welfare and supportive services in preparation for the pandemic. And I did want to mention also, as far as the talk in Washington, D.C. these days is concerned about program integrity, special enrollment periods really are a primary target of that discussion about program integrity. There is widespread concern throughout the country, particularly for states that utilize the federal marketplace or the healthcare.gov platform, for gaming the system or consumers taking advantage of special enrollment periods essentially as a backdoor. And in many cases, it is feared that these consumers wait until they actually need health coverage to enroll, and that's known as adverse selection in the insurance industry. We at Nevada HealthLink have been committed to stepping up our program integrity efforts, particularly as it relates to special enrollment periods. And I'm very happy to announce that as of this month, as of 2 weeks ago, we now verify 100% of special enrollment period applications. We require supporting documentation to actually validate that the qualifying life event occurred. So really trying to make some great strides in that area. And again, that's something that we can do largely because of the flexibility afforded to us as a state-based marketplace. So that's it for the background and overview. wanted to talk now about some budget highlights. Our agency request budget for fiscal year 2026, that's year one of the biennium, is just under $31 million, $30,963,195 with fees and reserves. That does mark a 3.7% increase from fiscal year 2025. And then for fiscal year 2027, year two of the biennium, that increases to $31,625,725, again, including fees and reserves. That marks a 6% increase relative to fiscal year 2025. We have requested 2 new positions in the budget. If approved, that would take us up to 29 full-time employees, but we do have 27 existing positions right now. And our revenue is based solely on carrier premium fees. We are a 100% fee-based agency, and what we mean by carrier premium fees is essentially we send an invoice to each of our insurance carriers for a small percentage of individual gross premiums each month. It's known as per member per month, or PMPM. That is the sole source of our operating revenue. We receive no general funds and no federal funds. All right, so I want to talk a little bit about the 2 new positions that we requested. The first new position is being requested at a Management Analyst 3 grade, and the purpose of the Management Analyst 3 is to serve a leadership role with respect to the review and certification of Affordable Care Act health and dental plans. That is a mission-critical role within our agency, and it's something that we do every year. It's a significant part of our annual cycle. That process is gearing up right now and generally continues through the end of September, and it entails working closely and collaboratively with the Division of Insurance to ensure that every single health plan and every single dental plan that's being offered for sale through the Nevada Health Marketplace not only meets the minimum standards of the Affordable Care Act in terms of essential health benefits, overall plan design, making sure that the deductibles and the maximum out-of-pockets are all in line with the maximum allowable thresholds as far as federal requirements are concerned, but also working closely with the Division of Insurance to ensure that provider networks are adequate, to ensure that what are known as time and distance standards are met, to make sure that, and this is especially important in rural Nevada, to make sure that there are not only enough provider networks within the geographic rating area or service area, but also that they are near enough to each of the potential enrollees in those areas that they can actually access that health care. So we are requesting this position to start on July 1st, 2025, and that is due to the onboarding of new insurance carriers. As I mentioned, this process is actually starting right now, but we really get into the thick of it in the July, August, September timeframe in that lead up to open enrollment each year. And did just want to mention that, we do have a plan certification position. We've always had one plan certification manager, but we have seen a consistent year-over-year increase in caseload due not only to the increasing number of insurance carriers offering health and dental plans through the Nevada Health Marketplace, but in many cases, increases to the number of plans that each insurance carrier is offering. In addition to that, there have been substantial increases in the program requirements for plan certification, owing in part to the forthcoming implementation of the Market Stabilization Program in Nevada. That program, just a brief summary, requires insurance carriers who are awarded a Medicaid managed care contract to offer health plans through the Nevada Health Marketplace and they're required to meet premium reduction targets. It's my understanding in the first year that they're going to have to meet a 3% premium reduction target. That's going to ratchet up over 3 or 4 years until they have to meet a 15% premium reduction target. Those premium reductions, by the way, are going to be available to all Nevadans, regardless of household income. So we think that's a really wonderful initiative for Nevadans, and we're very pleased to be working closely with the Division of Healthcare Financing and Policy in order to ensure a successful launch for this program. But it does mean a lot more work for us as well, and we anticipate that extra work is going to be around for a while. So that's a big part of the consideration that drove our request for the new position. There's a second new position that we're requesting as well. It's being requested as a health program specialist 1, but in practice, this position will be intended to serve as a tribal liaison to Nevada's 28 federally recognized tribal nations. That is in direct support of an initiative that we launched almost 2 years ago that we call our Tribal Partnership Program, and that is intended to establish and foster collaborative working relationships with each of those 28 federal tribes and allow them to make the most informed decision possible, essentially, about the best healthcare options available for their members and their family members as well. We have had great success. In the last year alone, we've seen a 33% increase in exchange enrollments for American Indian or Alaska Native, or AIAN as they're known, enrollees. And we have been working closely with 3 of Nevada's tribes to implement a program that we call aggregated billing. So tribes have been able to, since day one of the Affordable Care Act, sponsor the monthly premiums of their members, and they can establish criteria. It could be income-based, could be merit-based, through which they're going to sponsor these premiums, but they've always had to do so on an individual policy-by-policy basis. So if you can imagine, they literally get a stack of invoices at the end of each month. They're reliant in many cases on the enrollees to walk these into the local tribal health center, for instance, or to their local office on their reservation. And it works, but it's cumbersome. There's a pretty high administrative burden associated with that. And when we did some historical analysis on these enrollments, we found that they were more volatile than the average enrollment in terms of susceptibility to terminations for non-payment. Things fall through the cracks every single month, right? So we were looking at whether or not there was a way that we could roll up all these individual monthly payments into a single monthly payment that could be remitted directly from the tribe to the issuer. We've had great success with that program. We pilot tested it for basically the second and third quarter of 2023 with the Fort McDermott reservation in Humboldt County, and they've been great business partners. We have since expanded it. We now have Fort McDermott, Reno Sparks Indian Colony, Pyramid Lake is going to be coming online soon, and we've also been in recent discussions with the Walker River tribe to get them signed up for the segregated billing as well. There's a third component that I wanted to mention to the program, which is that we developed an assister role known as the Tribal Exchange Representative. And what that is it's kind of similar to our navigator role. Navigators are enrollment professionals. They receive grant funding from the exchange to provide free enrollment assistance throughout the state. The Tribal Exchange Representative, or TER, role is similar, but it's really designed and focused around members of Nevada's tribal communities. What we want to do is we want to train and certify members of these communities to offer application and enrollment and eligibility assistance right there in their own communities. We are on the cusp of, in fact, tomorrow, we're going to be hosting our second annual TER training up at the Reno Sparks Indian Colonies Tribal Health Center. Their director, Angie Wilson, has been a wonderful stakeholder partner as well. She might be a familiar name to some of you. She has been an invaluable resource, not only in terms of lighting a fire under this initiative, but also in terms of helping slowly but surely to educate us on cultural sensitivity and the many, many aspects which are integral to forging successful partnerships with these communities throughout the state. So we are very, very gratified by the results of this program thus far. It's also very clear to us that our current part-time liaison doesn't have the bandwidth to continue helping us grow this program in the future. Those are really the primary justifications behind this particular position request. Less interesting, but no less important, are the remaining enhancement units. Travel, we wanted to request an increase in travel. There's been a slow and steady increase to on-site seminars, conferences. A lot of those were held virtually throughout the pandemic era, and over the last few years, those have been increasingly held on site. So while our travel budget did decrease a little bit during the pandemic era, we are trying to get back on board with sending our personnel to these conferences. That's primarily the out-of-state portion. There's a lot of in-state travel that is necessary as well. I mentioned some of the successes of our tribal partnership partnership program. But those required getting out there and actually meeting these folks and going and visiting tribal government councils, speaking with them in their communities, on their terms. And we also have an office in Henderson. 4 of our 27 FTEs are located in Henderson. That's where all of the brokers and the navigators are, essentially, or the vast majority of them. So there's a lot of travel back and forth between Carson City and Henderson for navigator site visits, to speak at luncheons for the broker groups throughout the state. So in total, we basically are trying to get back to kind of where we were before the pandemic in terms of our ability to attend these out-of-state conferences, which really are invaluable opportunities to compare notes with colleagues throughout this country from other state-based marketplaces. We always come back enthused and with some new exciting ideas that we can apply in Nevada. I want to talk a little bit about training as well. I am very fortunate to work with an extremely well-qualified team that ranges in experience from brand new hires who are in their first year or two of employment with the state to folks who have been with the state for decades. One common denominator across all of our experience levels is an eagerness to learn and eagerness to gain on-the-job experience. So while it may seem kind of straightforward, may seem kind of like a no-brainer, we really are interested in providing on-the-job training, expanding the skills, the technical skills, as well as creative and technical writing skills, managerial skills, workplace remediation, how to communicate effectively with your coworkers. So really the training kind of covers all those bases, and really we want to focus in particular on the technical skills that will help us to continue to achieve efficiency gains as far as our different lines of business are concerned. And then memberships, registration, and licenses. We are members of a number of groups throughout the country. One noteworthy example is the National Association of State Health Policies, or NASHP as they're known. That is a group of state marketplace administrators throughout the country. I meet with them on a regular basis, and that membership, being able to compare notes with those other administrators, with my colleagues throughout the country, has been invaluable. In particular, in recent months, amidst the myriad changes that are being proposed in Washington, D.C., there was a huge rule change that just dropped, a proposed rule change the week before last. Being able to put our heads together and collaborate on innovative solutions to the problems that state-based marketplaces face is, I would say, an integral and valuable part of what we do. That's just one example of memberships, registration, licenses. I mentioned also, speaking to broker groups throughout the state. We do maintain a membership with the Nevada Association of, I believe it is Business Industry Professionals now, NABIP. They used to be known as NAHU, Nevada Association of Health Underwriters. And those types of, memberships, being able to get out and speak to those communities, again, provides us with an invaluable perspective, really allows us to keep our finger on the pulse of what's happening, not just with the Nevadans whom we want to reach, whom we want to get enrolled in health coverage, but also with the enrollment professionals, with the insurance carriers that are going to be helping us out in that job. And then lastly, perhaps most mundane of all, equipment and OCIO assessments. Essentially, we are just staying the course with our equipment replacement schedule. I believe, Jonathan, we also realized that we were a couple of phone lines short relative to our number of FTEs. Anything to elaborate on there? I apologize. I'm not super familiar with that one.
Jonathan Lopez for the record. No, we just had like 3 charges that were not unbudgeted, so we had to add them to our budget this season.
Right. Thank you, Jonathan. Russell Cook again for the record. So just trying to true that up, make sure that we have alignment between our phone lines, our business productivity suites, and our numbers of FTEs. All right, pretty straightforward there. And wanted to mention also, I don't know how many budget presentations you see that have a 240-day projected reserve line, but that is, obviously high. The reason why we maintain such high reserve levels is because the rules change on us every single year. I mentioned previously the special enrollment periods that were mandated by CMS. That's just one example. Another example would be that there was the subsidy increases under the American Rescue Plan Act back in 2021. That was something where where we only had a runway of a couple of months, and having that existing fee-based revenue on hand allowed us to implement those expanded subsidies within the required time frame without having to seek additional monies through the general fund, for instance. And I believe all we had to do was seek the additional spending authority. We were able to do that in parallel with going ahead and submitting the change request and starting work with our technology vendor. So that's just one example, but I can't think of a year in the last 6 years where having those reserve levels on hand and being able to respond to the rules that literally change every year. CMS puts out a document called the Notice of Benefit and Payment Parameters, or NBPP, and every single year the goalposts get moved. This year we had the distinct pleasure of getting 2 of those. We had one that was released in January under the previous administration. We now have a substantial set of rule changes that are being proposed under the new administration and are likely to come into effect within the next month or so. So it's going to be a busy 5 months or so runway to this year's open enrollment period, but having these reserve levels on hand, having that security and that peace of mind to know that all we need to do is work out the best solution, the best technical solution to these problems with our technology vendor is a big part of what has allowed us to achieve the successes that we have over the last several years. I would now be happy to take any questions from the board.
All right, thank you so much for your presentation and for walking us through those budget enhancements. I think we do have some questions, and let's see. I will start with Vice Chair Anderson, or sorry, Co-Chair Anderson.
Thank you, Chair, and thank you for the presentation. Great details. So it sounds like, based upon your presentation, I think it was about slide 11, you had mentioned that there is some new programs coming in, possibly, and then also there was I think it was the aggressive way to be able to look towards the public option. So can you please explain the expected impact of the implementation of the public option, on the operations of the exchange itself?
So in the lead up to open enrollment, Russell Cook for the record, by the way, thank you for the question. In the lead up to open enrollment, there will be, some increased caseload as far as plan certification is mentioned. We will have at least one new insurance carrier, and I'm not sure if I'm characterizing that exactly right. It's going to be an existing carrier who's offering their battle-born state plans, as they're known, or the BBSPs under the Market Stabilization Program. They're going to be offering those under a different brand name, a different doing business as or DBA name. And that does require us to onboard them as if they were a new insurance carrier. There's some technical systems integration associated with that. And then there will be just, market-wide, statewide, an increase to the number of plans that actually need to be certified. There are some additional components to the battle-born state plans that are not associated with the traditional ACA plans. We're working closely with DHCFP as well as our colleagues at the Division of Insurance right now to figure out exactly what the Division of Labor is going to be to, for instance, administer the reinsurance program, which is an integral part of these battle-born state plans and the Market Stabilization Program. So essentially, there's going to be an attachment point. The most recent figure I've heard is $50,000, I believe. Claims at or above $50,000 are going to qualify insurance carriers for the reinsurance piece. Now, at present, the exchange does not aggregate any utilization data, so we don't actually have claims data, but there will be a database, the all-payer claims database, going online in 2026. It's my understanding that that will be the likely source of at least some of the data that will be utilized to actually facilitate the reinsurance program. So we're working actively right now. I can't say right now today the extent to which the exchange is going to play a direct role in the administration of that reinsurance program, but from a strategic standpoint, we are working very closely with our colleagues across town to make sure that we're well prepared for that. In addition, there will be some quality metrics, quality of care, not only quality of provider care, but also customer service related benchmarks for insurance carriers themselves. As with the reinsurance program, we're working closely with DHCFP to position ourselves for success there. Again, I can't say exactly what that's going to look like as far as the exchange staff is concerned. What I can say for certain is that there's going to be a significant increase in this particular area of plan certification, not just in terms of the caseload that increases, but also in terms of what I would describe as a fundamentally new type of liaising responsibility with the insurance carriers who sell plans through the exchange. There's going to be a lot more information that needs to change hands back and forth. And there's going to be, I believe, a new depth, for lack of a better term, required in terms of maintaining those business relationships to ensure that this program is successful. So we're looking for this position to absorb not only the extra caseload, but also to serve as a liaison to these insurance carriers. That's a position that we've really never had before at the exchange.
Thank you so much. May I have a follow-up? And it's actually not on the same topic. It's from earlier in the slides. I think it was slide 7, where you were talking about that there was a 4% increase of people returning enrollees. How did you do that messaging? Was it in a variety of languages, or was it just one element? Because a 4% increase when it was already at that level, just wondering how you were able to get that.
Russell Cook for the record. Thank you for the question. The 4% increase that I referred to was specifically for unsubsidized enrollment. So these are for households whose income does not qualify them for subsidy eligibility. Could also be that they have chosen not to request the advanced form of the premium tax credits. We do have enrollees. We don't know how many because the IRS holds the keys to this data, but it is possible for applicants through the Nevada Health Link Marketplace to forego receiving, incremental subsidies on a monthly basis to reduce the cost of their monthly premium, and they can just square up with the IRS at the end of the year when they reconcile their APTC. But to your question, every single bit of advertising media, I guess, not my area of expertise, but every advertisement, every radio spot, every digital advertisement that we create, we transcreate in Spanish as well. So right out of the gate, we're doing everything in English and Spanish, but we also have established community partnerships with a number of health clinics and other entities throughout the state to help us translate our materials into other languages as well. One example I want to share is the amazing Asian Community Development Council, or ACDC, in Las Vegas. They have been unbelievable business partners. I had the good fortune of doing a site visit last year, and I walked in the door and I saw an entire wall of pamphlets that were in Mandarin Chinese, Korean, Tagalog, Filipino, Vietnamese, all of which reflected the same information as we had produced ourselves in our English and Spanish resource guides. So that's an area where we are working very hard to deepen those community partnerships, expand the reach, of being able to reach these, communities where English is not the primary language. English may not be spoken at all throughout the state. Not just having these, translated resources available at health centers, but also working with these community partners to get non-English and non-Spanish advertisements in community newspapers throughout the state. Just by virtue of the population demographics, most of that happens in Clark County. Some of that happens in Washoe County as well. But those are just a few examples of the types of initiatives that we're trying to really double down on in the future. Yeah.
And next, we'll go to Assemblymember Backus.
Thank you so much, and I believe you answered already part of my question regarding the new position for the management analysis, because our curiosity is most positions start October 1st, and we saw that you requested an earlier start date, and I think during your presentation, you indicated that was due to onboarding of the insurance carriers and obviously the open exchange starting November 1st. My question is, though, obviously our budget doesn't get out until the beginning of June, so if this position is approved to start by July 1st as it requested, how does the exchange plan to recruit and fill the position by such date?
So thank you very much, Russell Cook, for the record. Excellent question. So we've been talking about that exact question internally, actually. We have been working closely with the Division of Human Resource Management, in part because of the ongoing compensation and classification study, but also in relation to these positions in particular. That's kind of doubly tricky this year because we're asking for positions under the current paradigm, unsure of exactly where they're going to land when the compensation and classification study, is completed. We did receive preliminary approval, and I guess that would take us through June 30th of this year for this MA3 position at the MA3 classification. We are holding off on opening the recruitment until and unless it is approved in this legislative session. But to answer your question directly, if we have a few weeks at the end of June after this position gets approved in the legislature, but before that July 1st start date, we would very much like to open the recruitment as early as possible. But as I mentioned before, we don't intend to take any action until and unless this position gets approved by the legislature. You're welcome.
And Senator Taylor.
Thank you, Chair. And thank you, Director Cook, for being here, and thank you for the presentation. I want to commend you, your efforts in our tribal communities. I mean, it sounds like you've been really intentional about developing that partnership, and I know Angie, and she's excited, and she's one of those, she gets after it. So I do have a couple of questions though, about the position that you would like to add. How do you anticipate that this new position? What am I trying to say? What are what's the workload? What are the things you think this new position will be able to relieve from you, right? You want to have a new position so that you can jump. What's happening now that you expect this new position to be able to take over?
That's an excellent question, Senator. Thank you. Russell Cook for the record. So I would answer that in two parts. One is in terms of, what we're doing right now that is really kind of straining the limits of our bandwidth, right? So we do have already, we are attending a number of meetings each month, tribal health directors meetings. The Division of Healthcare Finance and Policy holds a meeting every single month where they talk about kind of the Medicaid climate, SNAP and TANF, and just general updates that would be applicable to these tribal communities. We have for years now been attending these meetings, but we have also seen a month-over-month increase in the volume of information that we're sharing, as well as the number of stakeholders, the number of tribal communities throughout the state with whom we need to collaborate to make sure that we're staying on course with our initiative. So it's really just gobbling up more and more time on a week in, week out, month in, month out basis, just to maintain working relations with these with the communities, make sure that the information that we're sharing at these meetings is up to date and is relevant and is consistent with and supportive of and complementary of initiatives that are being undertaken by our colleagues at Welfare and Supportive Services and DHCFP. So that already is straining the limits. Our part-time tribal liaison, just to clarify, is my executive assistant as well. She is a tireless individual, and she wears many, many hats throughout the exchange. But she has gotten to the point where a significant portion of her job duties are spent just preparing our agency for and then subsequently presenting at these meetings. She's also been working very closely with our Navigator Program Coordinator to develop the Tribal Exchange Representative training curriculum and also to schedule the training. So the training that's happening tomorrow at Reno Sparks that I mentioned, she has put dozens of hours over the last few months just into setting us up for success as far as that training is concerned, inviting all the different tribes, consistently emailing tribes with whom we have not established contact and are not actively participating in this program yet, trying to essentially drum up enthusiasm and get them to attend these meetings. So I would say that, as far as the continuation of those efforts is concerned, we will be needing, more and more bandwidth, more and more person hours as this program evolves. But a big part of why we are requesting this position is that we want to grow and expand this program. Every single one of these, at least every single one of these tribal nations that we have, actually communicated with, actually met with, and started doing work with, whether it's for aggregated billing, whether it's to get, tribal exchange representative trained. One aspect of the program that I didn't mention, which is hugely time-consuming, is working with insurance carriers to address issues that arise when these AIAN claims are not processed in the manner that they should be. AIAN enrollees are qualify for benefits through the Affordable Care Act that no other category of enrollee qualifies for. And in particular, they qualify for significant reductions for provider visits. Those are known as either zero or limited cost sharing benefits. And those claims, we have found, are very tricky for insurance carrier systems to process in an automated manner. So we've been working very closely with tribes as well as insurance carriers, not only to identify opportunities for insurance carriers to improve their information systems, but also to gather information from insurance carriers on resources, techniques, tools that might be available to tribes so that they can stand a better chance of getting their claims processed, from the get-go. So that's a very broad area, and it does require expertise from many exchange enrollees. Many exchange employees. But I would say that the hub that keeps all of that working is our part-time tribal liaison. on. So it would be, I guess, a liaison role, not just for tribes, but also for insurance carriers. Each one of them has a government affairs representative. All of them, it's my experience, have been making good faith efforts to try and perform better in this space. But it takes a lot of time to maintain those relationships. So those are just a few examples of what we're
I
looking for.
appreciate that, Director. Thank you. I was going to ask you about benefits realized, but you covered that as well. So, Chair, I'm good. Thank you.
All right, thank you. I appreciate all the work that you're doing to reach out to our tribal communities and strengthen those relationships. And I think that having someone other than the executive assistant be in charge of that makes a lot of sense. So, members of the committee, are there any other questions? I am not seeing any other questions, so I think that brings us to the conclusion of our hearing on this budget. Thank you so much for being here. I will now close the hearing on Budget 101-1400. And I think we only have one item left on our agenda, which is public comment.
Thank you, Madam Chair, members of the committee.
Anybody wishing to give public comment in person here in Carson City is invited up to the table to do so now. If there's anybody hiding in the corners in Las Vegas, now would also be your chance. Very interesting decision, but, stranger things have happened in this legislature. I don't see anybody in person in either location, so we'll go to the phones. Please, is there anybody here to give public comment on the phone lines?
Thank you, Chair. The public lines are open and working, but there are no callers to provide public comment at this time.
All right, then that brings us to the conclusion of our meeting. We are adjourned.